Good afternoon, and I'm going to talk to you about a study which actually was begun in 2017, and it concluded in 2022, having worked its way through COVID, so that is why we're a little behind on presenting things. And we have an ongoing study that began in 2022, I guess, and will be finishing in 2027 that follows up on the same group of people. And which button do I push to make the...
I think we're just saying next slide.
Oh, we are? Okay, that's unnerving. Okay, I'm going to I'm going to present some evidence on adult health coming from two sites in Atlanta and Seattle, which were part of this research study. There was also a site in Vancouver. And the problem that we were addressing was that despite the prevalence of FASD, despite the concern about FAS and the fact that we all know it exists and it is clearly a lifelong issue, there's really very little evidence or attention to long-term effects or how this manifests itself in adulthood. And there is a theory called the developmental origins of disease hypothesis, and it suggests that events occurring during pregnancy can have lifelong effects, particularly on health, and that often these do not manifest themselves until middle age.
Claire, can we pause just for 1 second?
Hmm?
Can we pause for 1 second and grab the...
Absolutely.
Apologies for the pause.
For some reason, we can't find the button.
Can they advance it?
It's right here. I see it. Is this not it?
Ah,
Yeah,
there it is.
sorry.
Okay.
There you go. Yeah,
Thank
yeah,
you so
there,
much.
Yeah.
All right, there's 4 of us and we figured it out. Here is a little bit about the what's called fetal programming, which is the idea that if something occurs during pregnancy, it can program the developing organism such that certain outcomes occur. And these may be across a wide range of effects. As you can see, it may affect immune function, it may cause cardiovascular problems, it may lead to a metabolic disease. And when we know from a number of other stressors that have been investigated that such things do in fact occur. I'm just gonna... We know what we believe is happening is the system is stressed, and as a result, it produces a whole range of negative outcomes. In order to investigate this in relation to alcohol effects, we carried out a self-report study with a number of individuals who were prenatally exposed to alcohol. And this was, in this case, I'm going to report on 370. And ask them about their access to health care, whether or not they had any chronic medical problems, and how this occurred as they aged. These people were identified either early in childhood in the Seattle cohort by Dr. Ann Strysko's lab clinic, or they were identified in Atlanta prenatally during the time the mother came for prenatal care to our hospital. I've listed in the middle of the yellow box, it shows the conditions which we asked about. And there were a number of conditions which were added to this that we felt probably needed to be included to the questionnaire that we had originally adapted from the Centers for Disease Control questionnaire. Here is information about those individuals who participated in this study. And we had both those people who were alcohol exposed and those people who were not, and they formed a control or contrast group. And it's really important to have a contrast group when you're dealing with something like this, because if somebody says, I have a heart condition, it's really important to know whether that is related to the exposure or whether that's just generally the case for people that age. So the individuals we were working with were around 40 years old, basically, 39 years old on average. They were diverse in their racial presentation, with the majority of those people in Atlanta being African American and those in Seattle being white, and Native American being the largest minority group that was involved. We also looked at things like how many years of schooling did they have, marital status, number of children, and household income. And those questions were asked in order to determine what social economic status these individuals had. We know there's certainly a relationship between social economic status and access to resources and health conditions. And that's certainly the case in the United States, because we really do have problems among some people getting adequate health care. And we asked the individuals in 10 areas involving various organ systems. Do you have a problem with such and such? Have you ever been diagnosed with such and such? There's 189 questions. I'm not going to present you with 189 questions. I'm going to just present you with some examples of what we found. So here, do you have problems? We looked at sensory systems. Do you have problems with vision? Do you have problems with hearing? And we asked about teeth. The CDC didn't ask about teeth or hearing, and I thought they should. As it turns out, individuals who are alcohol affected have more problems with hearing and dental issues, whereas everyone who's 40 years old apparently has problems with their eyes. So that was not, that wasn't very useful. We also, because we know that this is often an area of concern, we asked about cardiovascular issues. We found that those people who are alcohol affected were identified as having more problems with their heart when they were a child. It wasn't an enormously high number. It's about 4%, I think, but they more frequently. And people who were defined as having physical features associated with prenatal exposure were more likely to have cardiovascular problems. However, current problems just approaches significance, and no one was reporting to us that they had high blood pressure. When we actually took their blood pressure, however, they did have high blood pressure. That's another story. Another area we asked about, and it turned out to be very salient, was gastrointestinal problems. And these have to do with gastritis, bowel problems, and so on and so forth. This was an area in which those people who were alcohol affected reported much higher rates than the control groups. Another area that turned out to be very salient was urinary tract problems. So we asked if people have had kidney stones. We asked if they had bladder infections. We asked if they had problems with incontinence or not being able to control their urine. And again, those people who were alcohol affected reported that they had much higher rates of these than did the contrast group. We asked about endocrine problems, including diabetes and thyroid disorder, and we found a slightly higher rate of diabetes reported among those who had FAS, and we found that those people, both groups of alcohol-affected people, had more problems with endocrine or thyroid disorders. And we also asked about allergies. We are very interested in the issue of immunology, which Charlize is going to speak to. But we did not find them reporting higher allergies. Now, you have to remember, some of this is occurring in Atlanta. And last week we had an allergy pollen of 8,000 or 9,000. So it could be that everybody in Atlanta has allergy problems. We did find that there was a higher rate of reporting problems with skin, rashes, and eczema, and things of that sort. And then we asked if you had medical, have you been diagnosed with allergies I think that line's, okay. Another one was, has a medical professional diagnosed you with seizure disorder? And again, we found that individuals who are alcohol affected had more seizures than other individuals. The questionnaire also included information about mental health issues. And if you will look at this chart, you will see that individuals who are alcohol exposed reported having a higher level of mental health issues on all of the categories of mental health questions that we asked, except psychosis. So there was no increased incidence of psychosis, but depression and particularly anxiety were much higher in this group. So again, they're great. We've sent this paper for publication. There's a lot more in it than this, but the time does not permit me to go into it all. One of the important points about all this is how can we understand these outcomes? Is it just that prenatal alcohol exposure causes these issues? Is it a direct cause? Is it that it's associated with it for some other reason, perhaps social? Is prenatal alcohol exposure one of many factors that affect outcomes in these individuals? So we looked to see what kind of information we had in our data that might help us to understand these questions. And these included information about prenatal alcohol exposure, biological sex at birth, race, ethnicity, the level of education, whether or not the individual had access to health care. In Atlanta, for instance, which I'm most familiar with, if you are an adult over the age of 21, poor, you don't have access to Medicaid. And you may, unless you have a job, you don't have access to health care. So you may be in trouble in that regard. And another thing which we asked about was adverse childhood experiences. And some of you may be familiar with that issue. Adverse childhood experiences occur, well, I'll talk more about them, but they have been found to be highly associated with medical and mental health problems later in life. So when we look to ask about health care, we ask, have you been to the doctor in the last 12 months? Do you have health insurance, and what kind? We didn't find a difference in having gone to the doctor or having health insurance. We did find a difference in type of health insurance, with those people in the control group much more likely to have private insurance. Here is the adverse childhood experiences, and here we find that with the exception of, there are 11 items listed here, with the exception of experiencing the death of a parent or I think diagnosed or having a depressed caregiver, individuals who are alcohol exposed had higher scores on all of these items. The CDC has done research in this area and found that if you have more than 4, and I've marked 4 on the axis there, if you have more than 4 of these factors, you are at much higher risk for a host of health problems later in life. So what we're finding here is that we have people who are prenatally alcohol exposed, and these same people have had adverse childhood experiences. We decided to look at specific disorders and look at prenatal exposure plus all of these other conditions. And when we look specifically at mental health, for instance, here we're looking at depression and I think anxiety and ADHD, we find that depression is associated not necessarily directly with alcohol, but with the adverse childhood experiences, which are higher in those who had alcohol. So it is as though you have the alcohol, you have the experiences, and then you have the depression. However, when you look at the ADHD, you see that this is directly related to alcohol. So we have a complex picture here. Yes, you have more problems when you're alcohol exposed, but there may be multiple factors that enter into this. When we look at other diagnoses, diabetes, cancer, thyroid disorder, and so on, we find a relationship between prenatal alcohol exposure and adverse childhood experiences and cancer, sex, and a number of different factors here are driving whether or not you report having had cancer. Similarly with diabetes, we see that prenatal alcohol exposure is affecting it, but there is a contribution from other factors as well. Thyroid disorder is similar. There's a direct effect of the alcohol, a direct effect of adverse childhood experiences, and a direct effect of age. I also did a regression model for kidney stones and found that there was a direct effect of alcohol. But in this case, the adverse childhood experiences were not contributing. Age and social class. Social class was not, age was, sex wasn't. So the point I'm trying to make is that we are looking at a very complex set of issues here. Now, that sounds bad, but there may be some positive aspects of that because we could change some of these things. We could change how many adverse childhood experiences someone has. For instance, if we intervene in their situation appropriately, we can also allow them to get better health care. What are the implications? These results suggest that alcohol exposure does have long-term implications on health, and that there's a range of outcomes, a range of health outcomes. Given that alcohol-exposed adults should have more appropriate medical care than they're typically receiving, the physicians they're working with should have more information about the implications of such exposure. And another question that has come to us is this a question of premature aging? Is this something that people who are alcohol exposed are simply getting earlier than the average person? Mental health problems are also more common, and the physician should be screening for that so that the individual can get care. How do we prevent these problems? Well, the direct effects of alcohol obviously can be prevented through reducing the amount of alcohol women use in pregnancy, and certainly that is something we all should be thinking about and considering. But we also could deal with indirect effects that are associated with prenatal exposure, and we could start identifying people who are alcohol affected very early and trying to intervene to prevent some of these other negative factors from influencing outcomes. Finally, what are we doing in terms of further research? Well, at the moment, as I said, we're following up these individuals again. We're also comparing them to characteristics of older adults, 65 and older, to see whether this is related to early aging. And we also, I believe, we need to advocate more for alcohol-affected individuals with people who can influence medical care. And here's just a number of the articles we've recently published from this data set, and more will come along, and hopefully will have some influence on the medical profession. Thank you.
So we've got time for one or two questions from the audience. Would you mind throwing the previous slide back up on the screen? The one with the articles, that? I'm sorry. Yep, thank you.
No question?
No questions? Okay.
No, that one person has.
Hello?
Hi.
Hi, I'm Elizabeth Herman, also from Atlanta. And and forgive me if I missed this, but what was the effect of actual alcohol used by the alcohol-affected individuals or other substance use on the outcomes?
Do you mean alcohol and drug use by the person who
Yes.
was alcohol affected?
Correct.
Good question. We did, in fact, collect that information. There is a relationship between mental health and substance use. But you would probably be shocked to discover that there's not a really high level of substance use in these samples. I know everybody is convinced that there is, but there wasn't. So I don't think that the use of by the individuals was what was causing these things to occur.
But it is self-reported. It's self-reported use.
I can't hear her.
Self-reported.
We also took blood tests and urine screens and so on, and I'm pretty sure that we have a guess anyway about what was going on.
All right. One more.
Hi, my name is Julian Zita, and I'm here with my son, John Franco Zita. And my question is this: being the birth mother of my son, I am always looking. I really appreciate FASD United's research blurbs that are going on and all the studies. Like 25 years into this gig, I am always reaching out, trying to find people like yourself who are doing research because I have data to share.
Mm-hmm.
But connecting the families with the researchers is not so easy. And I'm just wondering what the panel or yourself suggest as a person who's willing to take the time to fill out those 189 questions. Because if I don't pay it forward, then what am I doing here?
Well, that's wonderful, and I think actually there are some of our studies in which if your son would be willing to fill out the 189 questions, we would be delighted to have him do so.
Great. All right. Thank you, Claire.